Morning. I'm Celena Roldan, the Director of Child Care Services at Erie Neighborhood House. So I'm going to start by telling you a little bit about Erie House as a place-based initiative, and then talking a little bit about why we integrate services, how we're able to do that, and then lessons learned and possible policy implications and recommendations. The mission of Erie Neighborhood House is to strengthen and empower low-income, primarily Latino families through skill building, access to critical resources, advocacy, and collaborative action. We're able to accomplish this mission by providing not only high-quality, nationally accredited child care services, but multiple services based on the needs of our community and our society. Erie Neighborhood House is located in Chicago's Westtown community, and offers not only this high-quality early childhood program, but also nationally accredited after-school programs, a youth options program serving teens that facilitates an academic achievement program with a 100% high school graduation rate and a 97% college placement rate, adult education programs that include ESL, GED classes, citizenship classes, and literacy tutoring, all which have waiting lists, emergency services, technology training to over 1,600 community residents, and one of our newer initiatives, community leadership and advocacy, that includes the Erie Institute for Social Justice training program. In 2005, Erie House opened its own elementary charter school, one of few serving primarily Latino children in the Humboldt Park area of Chicago, where children are offered academic excellence in a biliterate, bicultural school. I mention these because it is important to understand the need for place-based initiatives such as ours. You need to understand the population that you are serving and what faces those participants. So I want to reiterate a little bit of the statistics about the demographics that AJ already mentioned as it relates to our families and poverty. According to the National Center for Children in Poverty, 18% of children in the U.S. live in families that are officially considered poor. The 2008 Health Human Services Poverty Guidelines reports that families with incomes below federal poverty level are families of four that earn less than $21,200 a year. Families with income below twice this level are referred to as low income. I mentioned the specifics about income because I think it's important when we're talking about policy and we're talking to funders and legislators that we use those numbers so that people really understand what we're talking about. Erie House Preschool Program serves 289 children, and out of those 289 children, 140 families are Head Start and Early Head Start eligible, which means that they meet the 2008 poverty guidelines. So the single mother with a child that comes into my program every day, she is making less than $14,000 a year. The National Council of La Raza printed a report last year called Buenos Principios, Latino Children in the Earliest Years of Life. And I want to mention that report because it gives specific statistics about Latinos in poverty. According to this report, families of 2/3 of Hispanic children, 67%, under the age of 3 have income that is 200% below the federal poverty level. Compared to 39% of white families with infants and toddlers. And as AJ has already mentioned, understanding this level of poverty is important because as is exemplified from other multiple studies, the economic challenges for families during a child's first years of life can dramatically affect their development and school readiness. It was just reiterated again this week in a report by USA Today, the impact of poverty just on children's brain development, and that was really important for us to understand as well. This piggybacks on other studies such as the other well-known research that we know that children in middle-class families have vocabularies that are almost twice the size of poor children. So all of these factors, I mention them because they're important factors for programs, place-based initiatives, programs such as Erie Neighborhood House that we needed to acknowledge and consider in creating our programs, modifying existing programs. Erie Neighborhood House is one of the original settlement houses that's been in existence for over 138 years and has served a very changing immigrant population from originally German and Italian and Polish to now predominantly Latino, Mexican, Puerto Rican families, but again, it's about recognizing what the needs of the community are. So how do we support families through these integrative services? All of these factors creates the programs at Erie Neighborhood House and motivates us to create a sustainable place-based initiative that can truly create change. Also similar to the Harlem Children's Zone, comprehensive services at Erie Neighborhood House are longitudinal to create a greater and lasting impact. We take children as young as 6 weeks, and we can keep them through their teens while offering educational and empowerment opportunities for also their parents and families. So we can have a child in our preschool program, a youth in our teen program, and that parent can also be taking ESL classes, and another parent is also in our citizenship classes. And that's really where we feel we're able to provide a comprehensive, holistic support for these families that are living in poverty. The other part of how we support families through integrative services is that we need to acknowledge the quality, and the quality that needs to be happening in these programs. It's not enough to just have all these supports in place, but are they high quality? We need to have an ethical responsibility and understanding that just because you are poor does not mean that you do not deserve the best and highest quality of services. We strive to assure that our programs are as high quality for those that cannot afford as those that are able to select care for their children or decide what school their child will attend. Those are not necessarily the options that we know that our families serve or that they're knowledgeable about, and that's about providing those resources for them. So some brief lessons learned. What are policy implications? I think it's really important for programs, place-based initiatives, to facilitate an intensive, comprehensive community assessment and regular internal and external agency evaluation. It's an extremely worthwhile piece and the first step to sustaining successful place-based initiatives. Organizations such as the Harlem Children's Zone created initiatives based on what was determined to be the needs of the community. For example, knowing that they had a very high asthma rate of more than 30% of the children in the area, they then in turn created one of their asthma initiatives to address this issue. And again, this is a major piece of the sustainability of Erie House, despite the major demographic changes. President-elect Obama has introduced a comprehensive 0 to 5 plan to provide critical supports to young children and parents, as AJ also mentioned, by investing $10 billion per year to create early learning grants, increase Head Start funding, improving quality of these programs, access to preschool, providing high-quality care. Much of this platform is based on the research that shows that the achievement gap between low-income children and their higher-income counterparts. Again, this is very important when you're talking about poverty because impacting the disparities in education doesn't just involve increasing parent incomes, but truly impacting poverty in children involves policies such as addresses social, economic, and educational reform. Again, another policy implication would be to increase early Head Start and Head Start funding, but also the flexibility. President-elect Obama's platform is promising to provide support for families with children up to the age of 5, increase Head Start financing, quadruple the money spent on early Head Start to include $250,000 for infants and toddlers. There should also needs to be an increase not only in the funding for the programs, but the ability for families to be able to access these services. Income eligibility for child care assistance is a problem across this country as it is in Illinois. The child care cliff, so to speak, keeps working families from achieving true financial self-sufficiency because a minor increase to their income could cause them to lose their child care assistance. I use the example of in order to receive child care assistance in the state of Illinois, the cutoff is $28,000. So if a single mother receives a 10-cent increase an hour to her income, it could technically cost her $10,000 a year in total income because that 10 cents will push her off of the edge. Then she'll be making $29,000 versus $28,000, which, then by all means she's not wealthy, and then loses her child care subsidy. So I see families and talk with parents every single day that turn down raises, they turn down promotions because it would cost them more if they lose their child care assistance. And obviously child care assistance is directly related to parents and families being able to work. Lastly, we need more flexibility in that sense, and we need more acknowledgement of what families need to be able to do to get ahead. Lastly, city, state, and federal entities need to be able to communicate and collaborate to allow flexibility for these place-based initiatives in regards to funding. Many of our funding challenges come from meeting the requirements of one funder, but this is not acknowledged by another, which in turn has several of the other requirements and mandates. The Child Care Assistance Program at Erie Neighborhood House, we receive Preschool for All dollars, which is the Illinois Preschool for All program. We receive child care assistance dollars. We also receive Head Start, Early Head Start dollars. We serve private funding. We'll take money from whoever will give it to us, really. But again, programs need to be able to utilize these multiple resources and simultaneously to create the highest quality programming for those